are held ethically to our mission statement. Your charge, my charge, is to make sure that anybody that walks through ANMed Health has access to whatever a resident of this community has access to. Their status, how they got here, how they're going to be here, doesn't matter. The limited English proficient population in the upstate of South Carolina is growing rapidly, and so healthcare providers are being challenged to meet this growing demand.
Yes, that's normal.
Eso sí es normal.
Having a translator to be here when the patient comes in to initially find out what's going on with the patient is extremely important to us as physicians. There's nothing more frustrating than not being able to relate to your patient. I want to know what's going on with the patient, and the patient wants to understand me. The translator is the bridge that allows that to occur.
Okay, the doctor left you 4 prescriptions.
El doctor te dijo 4 recetas.
1 tablet daily, the same time every day.
One of the biggest fears that new immigrants have in this area and any region of the United States is that they leave behind their immediate family. So when they come to the States, they call interpretation services a lot because of the number of questions that they have.
It doesn't do an awful lot of good to send them home with instructions that they don't understand, either linguistically or that they can't comply with culturally. Our emergency department is our most expensive point of contact in the hospital system. So we don't want someone to come back 4 or 5 days later to our emergency room because they didn't understand what they were supposed to do at the time of discharge.
In the past, we've had people who knew the language but didn't understand medicine. You have to bridge between medicine, language, and the patient's needs.
Ask him, has he had any other medical problems?
¿Has tenido otro problema medical?
No.
Ask him if he takes any medicine on a regular basis.
If a patient comes to the emergency room and says to the doctor that he took 10 pills of Mejoral, the doctor has no idea of what the patient is talking about. At MedVerse, we have compiled a database of over 10,000 Latino medications, and we will be able to tell the doctor that that's nothing else but Tylenol.
I can remember prior to the translation services at our hospital that it was so frustrating to only get a few words in English. That is improper medical care. That is dangerous.
I'm hungry.
Having a program such as the program that we have at ANMed Health has made my life easier, it's made my patients more comfortable, and it's made the healthcare system, I think, better in our community because we're providing a quality health care to people who are not able to speak our language.